Hi, my name is Mani Alikhani. I am Dean and Professor at CTOR Academy, and I'd like to welcome you to another session of CTOR channel. Today, as part of biology in orthodontics and craniofacial orthopedics, I'd like to pose an important question and together explore the answer. Does the application of static orthopedic forces have any effect on cortical bone? And why this question is important? Assume you are applying an expander for your patient. Does expansion really cause resorption of alveolar bone and therefore can explain the presence of dehiscence and perforation inside the cortical bone? The common understanding is yes. Due to the movement of the tooth to alveolar bone, the tooth very soon reached to the cortical bone, and because the cortical bone cannot adapt, therefore you're going to have resorption in cortical bone and dehiscence. To explore this question, let's design an animal experiment. In this experiment, we expose rats to the transverse forces, and we study the changes in the cortical bone of the rats. Just to refresh your memory, we discussed that the cortical bone, or bone in general, does not recognize the static forces. So any changes that you are seeing in the bone is not due to reaction of the bone cells to the static forces. Let's see what happens histologically when we apply static orthopedic forces to the maxilla of the rats. We notice that the osteoclast appear in the periosteum layer, that is the soft tissue layer that covers the cortical bone, early in response to these forces. Does this appearance coincide with the tooth movement? When we look at histology, we notice that these cells appear way ahead of tooth movement, and actually sometimes appear even in the areas that there is no tooth. So if we look at the graph of the tooth movement and look at the time of appearance of this osteoclast, there is no relationship between them, which means that the appearance of this osteoclast is not dependent on orthodontics tooth movement, and reject that common understanding that tooth movement causes bone resorption in the buccal cortical bone. It is not related to the tooth movement. But why does osteoclast appear in the surface of the cortical bone if the cortical bone does not recognize static forces? Previous experiments in the long bone demonstrate when you are applying static forces in the format of the bending of the bone, that increase the convexity of the bone. Bone doesn't like to be bent, therefore by activating the osteoclast, it will try to keep its original shape. Is this theory correct? Let's test that together. Now, let's change the direction of our force 180 degrees, reverse, and study the appearance of the osteoclast. This time, we did not increase the bend of the surface of the bone, we actually decreased the bend on the surface of the bone. Does the osteoclast appear in the surface of a cortical bone again? The answer to this question is yes, osteoclast appear on the surface of the bone. The third question that comes to our mind, if the bone does not recognize static forces, if the tooth movement does not cause the appearance of this osteoclast, and if the preservation of the curve of the bone cannot explain the appearance of this osteoclast, what else can cause this osteoclast to appear? Is it possible that the effect that we see in the periosteum is related to the trauma? In another word, application of transverse forces cause the bone to move in the space and stretch or traumatize the membranes that envelope the bone, periosteum from outside and endosteum from the inside, and that's why these cells appears on the surface of the bone. We should see appearance on inflammatory markers early in these tissues in response to application of transverse forces. So let's go and measure these inflammatory markers. As we assumed, the appearance of inflammatory markers increase significantly in response to application of the transverse forces. And if this is correct, if I use anti-inflammatory medication, can I prevent the appearance of osteoclast even though the transverse forces still exist? We expose the animals to anti-inflammatory medication and we notice that the osteoclast numbers decrease significantly. So all these things tell us that this phenomenon is trauma-based. Now, what happens if I apply a force? Not in the direction that stretches the periosteum and does not cause that much trauma to the periosteum. Is that going to activate the osteoclast? To do this, we change the direction of the force instead of 180 but 90 degrees. And we notice the number of osteoclasts on the periosteum decrease significantly. Is this inflammatory based phenomenon limited to the periosteum? As you can guess, no. Regardless of the direction of the force that we apply, osteoclasts appear in periosteum and endosteum, and that's due to the just displacement of the bone in this envelope that holds the bone. And that catabolic effect is activated when we apply static orthopedic forces. Is this the end of the story? To know the answer to this question, you need to wait for the part 2. I hope you enjoyed this session of CTOR channel. If you have not subscribed to our channel, please go ahead and subscribe, and please don't forget to press the like button. Thank you.